I want to introduce Dr. Shelly Hester. She is here to give a wonderful science training. She is so intelligent. You're going to want to bring your notebooks out and just take so many notes from the things that she has to share today. But I'll turn it over to you, Shelly.
Thank you, Kayla. And I'm so excited to be with you guys today so we can really dive into digestive health and some of these causes of digestive complaints. So, the normal gastrointestinal tract is quite complex and it's quite extensive. It starts at your mouth and it goes all the way to your large intestine. And we like to think of our gastrointestinal tract of having both the upper GI and the lower GI. So your upper gastrointestinal tract starts in your mouth. As soon as you see food, as soon as you eat food, your saliva is releasing enzymes that help break down that food. The upper GI tract also includes your stomach area. And then your lower GI tract is more of your small and your large intestine. And many organs are involved in digestion, and anything that adversely affects digestion can cause discomfort. And it's so important to have proper digestion so you have overall good health. So, unfortunately, the prevalence of digestive complaints is really common. And this is data from a survey that was from 70,000 individuals, adults in the US. And this was a national GI survey. And what they reported is that 61% of the people that filled out this survey had at least one GI symptom in the past week. And the prevalence is slightly higher for females at 65% compared to 57% for males. And some of these complaints included things like heartburn and reflux, abdominal pain, bloating, diarrhea, constipation, nausea, all complaints that we do not want to deal with on a daily basis. And, there's a lot of different causes for digestive health issues. And some people might have one of these issues. Some people might have a few of these factors that are impacting them. And so one of those is dietary intolerances. So we definitely consume things in our diet that can affect certain people that aren't able to digest these different compounds. And these can be things like gluten or the proteins or the lactose in dairy, or even certain carbohydrates certain people have a hard time digesting. And then stress and mental health. I think everybody would agree that there's definitely this gut-brain axis connection, and that we know, like, when you're feeling stressed, that definitely causes some GI issues. Then strenuous exercise or endurance exercise can definitely impact digestive health. And we'll talk a little more about that in a few minutes. But endurance athletes do tend to complain about digestive discomfort. Also, alterations of your gut microbiome can impact digestive health. And also your colonic transit time. And this can go actually both ways. So sometimes our transit time, basically the rate that food takes to get through our GI system, can be too fast and cause things like diarrhea, or it can actually take too much time and cause constipation. And then organ function. So we talked about the GI system is complex. There's a lot of different organs that impact it. And you have these accessory organs like the pancreas, the liver, the gallbladder that are releasing bile and enzymes that help break down the foods that you eat. And if there's any issues in these, then that can also impact digestive health. And then inflammation. If you have inflammation in your GI tract, that can definitely cause digestive complaints. So there's a lot of traditional approaches to better digestive health. You can exercise on a regular basis, stay well hydrated, eat a balanced diet to make sure that you're getting plenty of fiber. But unfortunately, a lot of people turn to some of these other approaches that may not be the best over time. So one of these would be laxatives. So these are compounds that basically increase your stool weight and help you retain fluids and can be stimulants. And for many individuals, this can cause diarrhea and even abdominal pain. Antacids are another common approach where it basically neutralizes that acid in your stomach. And this, again, has many adverse effects, including constipation and nausea, and not an approach that you want to do on a daily basis. And then pain relievers. This is something that people take to help with acute pain. And unfortunately, if you're taking these over time, that can have acute liver damage. It can also cause some GI discomfort as well. So we wanted to look, are there better approaches? Are there different ingredients that are more natural and plant-based? So we've identified 3 different ingredients that are really good fits for helping with digestive health. One is a standardized artichoke extract. Another is a standardized ginger extract. And then there's also a green kiwi fruit powder. So now we're going to go into each one of these ingredients and the studies that have been done with them. So the first ingredient is a standardized artichoke extract. And this is an ingredient that has a number of mechanisms of action for digestion health and has a number of traditional uses. So one is it promotes the bile flow to help with digestion of foods that you're consuming. It's actually been shown to help relax the smooth muscles in your stomach to help with that gut motility. Additionally, it delivers antioxidants, which really offers that gastroprotective effect. And then the next ingredient we're going to talk about is a standardized ginger extract. And this is an extract that is standardized to 25 to 30% gingeroids. And it also has a number of different mechanisms and traditional use. So it also acts on gastrointestinal motility and basically how fast food is moving through your GI system. It also has this anti-nausea function. And I think this is a very traditional use for ginger, and that it's been used by pregnant women that may have nausea, or for people that get motion sickness, take ginger because it does help with that anti-nausea feeling. Additionally, it also delivers antioxidants and anti-inflammatory compounds to provide that gastroprotection in the GI system. And so the first study with the standardized ginger and artichoke extracts shows that it basically helps improve gastric emptying. So in this study, they had 11 healthy volunteers, both men and women. And what they did is they actually used an ultrasound and they measured their stomach area before a meal and then 1 hour after a meal. And so what the subjects did is they took a placebo or the supplement with the ginger and artichoke along with a meal. And this meal was actually like spaghetti and orange juice, so a pretty heavy meal. And what they saw and what you see in the bar graph is that after the meal, the placebo had significantly more gastric area 1 hour after consuming the food compared to the individuals that also took the ginger and artichoke meal. And that those individuals actually had a 24% decrease in gastric area. So what this study is showing is that it works with one dose, an acute dose, and that it helps with that post-meal heaviness that you may feel if you eat a big meal. So the next study is in a population that has functional dyspepsia. And so what functional dyspepsia means and the symptoms that go along with this is having epigastric fullness or stomach pain or bloating or early satiety, nausea, vomiting. And these individuals actually took the ginger and artichoke supplement with both lunch and dinner for 4 weeks. And they took it with lunch and dinner because these tend to be our larger meals here in the US. And when people complain about these dyspepsia symptoms. And what they found is that at 2 weeks, they had a significant improvement in the complaint of these different dyspepsia symptoms. So 84.6% of people in the supplement group noted the improvements at 14 days. And then these benefits were still maintained and efficacious at the 4-week period at the end of the study. And then the third study done with the ginger and artichoke was actually done in a population of endurance athletes. So like I mentioned earlier, endurance athletes tend to have complaints about GI health because a lot of times their blood is not just going to their GI tract, it's going to the muscle. They have different gastric motility. They can even have intestinal permeability issues. And so there are a lot of complaints in this population and individuals. And what this study did was they gave them a placebo or a supplement with the ginger and artichoke and simethicone, which is a commonly consumed ingredient in this population to help reduce gas for 4 weeks. And they took the supplement 30 to 60 minutes before training. And what they showed at 4 weeks is that the supplement was effective in reducing that mean intensity of both upper and lower GI symptoms. So some of those lower GI symptoms were like diarrhea, intestinal cramps, and the upper GI symptoms were like belching and bloating. And so if we go to the next slide, we can see the third ingredient we want to talk about today is a kiwi fruit powder. And so this kiwi fruit powder is pretty unique in that it delivers both soluble and insoluble fibers. So the soluble fibers include things like pectic polysaccharides. The insoluble fiber includes things like cellulose and hemicellulose. This powder is actually quite unique in that it also delivers actinitin enzyme, which is actually an enzyme unique to kiwi fruit that helps break down proteins that we consume in our diet. It's also cold pressed, which means that it preserves those polyphenols and those enzymes so that they can then be consumed and effective in our bodies. And the mechanism of action for the kiwi fruit powder has been shown that it helps improve gut transit and bulking, and it actually improves water retention in our digestive symptoms. So that basically makes it a softer stool and easier to pass. And so in the next slide, you can see that the clinical study that was done in a kiwi powder was done in a healthy adult population where they consumed 600 milligrams of this kiwi fruit powder every day for 4 weeks. And what they saw is that the kiwi powder actually resulted in a significant improvement or increase in the daily bowel movements. And this is clinically significant. They also showed that in the study that it was safe and well tolerated with no adverse effects. And so the benefits of these ingredients, first, the artichoke and the ginger, it helps improve that gastric emptying, that post-meal heaviness. It supports relief of bloating and gut discomfort. They've also been shown to help decrease discomfort in both the upper and that lower GI tract. And then you have the kiwi fruit powder that can help with the lower GI support and really support that healthy digestive function. And in this slide, we just want to hit on the point that, gut health is complex, it is diverse, and there's a lot of different ingredients and foods that can help with gut health. And so one of these is probiotics. So probiotics are those live organisms that basically colonize the gut and have very specialized benefits. One benefit that you commonly see in probiotics is helping with immune health. Another ingredient that can work through your GI system is anthocyanins. So anthocyanins are these dark purple colored pigments that are in many of the fruits and vegetables that we eat. And they've been shown to help support gut microbiome, which can then is one of the mechanisms that it can impact metabolic health. We also have ingredients like prebiotics and postbiotics. That prebiotics are basically the food that those healthy, beneficial bacteria in our guts are eating. And then the postbiotics are actually those beneficial substances from the bacteria. And then there's ingredients like ginger and artichoke that we talked about today that have been shown to really help relieve digestive discomfort. So thank you so much for letting me talk to you today about digestive health. It's been so fun, and we look forward to talking about this more.